Good afternoon. Thank you very much for the opportunity to represent Adverum and bring you the patient voice in this presentation. High treatment burden remains a significant unmet medical need that leads to real-world vision declines in patients with wet AMD. Patients who remain compliant with their treatment also experience suboptimal outcomes due to retinal fluid fluctuation and the association with repeated bolus anti-VEGF injections. Adverum's Ixo-vec is an AAV gene therapy that utilizes the 7-amate capsid that was engineered through directed evolution and enables intravitreal administration and constant, stable intraocular aflibercept levels, which we've measured out to 5 years. Ixo-vec can enable one-and-done treatment for a majority of patients after a single injection. The 4+ years of clinical experience across 3 doses of Ixo-vec have established a 10-fold safety margin and a potential best-in-class target product profile for Ixo-vec at the 6E10 dose that we have advanced to phase 3. The design of the Artemis phase 3 trial was informed by key learnings from the 4-year outcomes from the OPTIC trial and the 1-year outcome from the phase 2 Luna trial. And these studies were conducted in patients that required frequent anti-VEGF injections, on average 10 annualized injections prior to enrolling in these studies, and you'll hear from 3 of those patients today. At the 1-year time point, Ixo-vec achieved comparable and maintenance of visual acuity and disease control in the Luna study. This was accompanied by significant treatment burden reduction, with over 50% of patients remaining free of injection at the 1-year time point. 75% of those that received less injection the year before achieved this outcome, and Ixo-vec was safe and well tolerated. You'll now hear from 2 of the patients that were enrolled in the Luna trial.
My name is Lois, and I'm 91 years young, and I have macular degeneration.
My name is Joe. I'm 71 years old. I'm retired from 30 years of transportation, and I've been treated for AMD.
Joe has one eye that has wet macular degeneration, and once he qualified for the study and we gave him an injection, he hasn't required any injections now for over a year.
Ian, how are you doing today?
That's fine.
Lois is our second patient in the trial, and prior to being enrolled in the trial, both eyes have required multiple injections.
I got 1 shot, and I haven't had one since in that eye. And this is the bad eye. My left eye is my bad eye. My bad eye has turned out to be a good eye.
With a potential therapy that may be just 1 injection using gene therapy, I think that would really be a game changer for these patients.
We caught up with Joe at the 2-year time point.
This is my last video. My vision has improved. I was really worried while I was losing my vision that I'd go blind, not to see my grandchildren grow up, and it's just improved my life 100%. I travel more, I drive more, I enjoy life more.
In the 4-year results of the OPTIC trial, we also saw maintenance of BCVA and anatomic control. This was accompanied again by significant treatment burden reduction, with almost 50% of patients remaining free of injection. This is a representative case of an 81-year-old that was enrolled in the OPTIC trial. As you can see, they received 9 injections in the 12 months prior to enrolling in the study, with persistent active disease at every one of those visits. In the screening period, you see that the patient actually responded to a single loading dose of aflibercept at the 2-week time point, And since enrolling and receiving Ixo-vec, the patient has been free of injections after 4 years of follow-up with improved clinical outcomes. Here now we'll hear from Anne, who's a patient that was enrolled in OPTIC.
My name is Ann, and I have wet macular degeneration. I'm 85, so, I feel good. I've got a personal trainer. I've been working on the machines. I've been losing weight. I got myself on a healthy diet, and I do about 10 laps in the pool breaststroke.
Anne was initially sent to me by Dr. Rand in March of 2015. And as soon as I met her, I could see this bubbly, boisterous, energetic, lively individual.
Every month I had to go and have a shot in my eye. I did that for about 4 years, 5 years. And Dr. Dancing said, do you want to be on a trial?
She entered in June 2020. We injected her in the clinic. She's had 0 injections since. To go 4+ years without an injection is unheard of. For her, it was a home run. Her experience has been great. We don't need to do any injection today. 4 years and 4 months.
Okay.
Way to go.
Thank you so much for helping me.
The results of the pre-specified patient preference survey in LUNA confirm all of the experiences that I've shared with you today. Patients overwhelmingly want something better than they're receiving today, and they preferred Ixo-vec. We are thrilled with the enrollment of our Artemis phase 3 trial that is ongoing. It's enrolling a broad patient population, and it is designed to demonstrate that we will achieve comparable efficacy with a single injection of Ixo-vec versus on-label aflibercept with significant reduction in treatment burden. We're so grateful to all of the patients, including Joe, Lois, and Anne, and are really thrilled to be able to develop a treatment that can not only preserve sight, but also transform the life and experiences of patients. And thanks to all the investigators that have participated, and huge shout out and kudos to the resilient team at Adverum who has persisted and worked hard to make this treatment closer to the finish line. Thank you.